So very good evening, everyone. Today is the third day of our diabetes class. So today we will learn from our Vijaya ma'am, Dawn and Somogyi. So these are two natural phenomenon. Especially it causes the high blood sugar level in the morning. So most of you have learned this during your MSCs or BSCs in your college time. So how it is related, how to control this we will learn from Vijaya ma'am. What is the mechanism behind this? Actually, dawn phenomenon happens naturally, but when we called about Somogyi effect, it usually happens because of this diabetes routine management problem. So everything will be discussed today. Any confusion regarding anything, you can we can discuss after the class. But today's class is going to be very enriching. So welcome Vijaya once again.
Good evening everyone. And yes, right, today's topic is going to be very important because these are the real life situations that you generally get to see. Yes. So like it is already being introduced that today we'll be learning about the dawn phenomenon and the Somogyi effect, correct? Okay, now before I start the class, I just wanted to know that do you have any previous idea about dawn phenomenon or Somogyi effect? Anyone would like to say? Bolo. কেউ কিছু জানো dawn phenomenon কি হয় বাস what is Somogyi effect, whatever you know?
Anyone from the past batch, Fatima, or anyone those who have learned in the past batch, they can also
Ma'am Shalini?
Yes.
Ma'am, blood sugar rise in the early morning, both in dawn phenomena and Somogyi effect.
Absolutely correct. Yes. So basically, in both the cases, there is one thing common that in the early morning hours, the blood glucose level is high. And this is definitely very dangerous for the diabetic patient. So it comes under a complicated diabetic condition. So today we'll be learning their pathways. We will be learning how it happens, what are the management systems, what we can do about it. So basically last day also we have been discussing about the multiple complications of diabetic mellitus. So we have learned about the ketoacidosis. We have learned about the HHS pathway. We have learned about retinopathy, neuropathy, and nephropathy, right? Now you see that other than this, there are two major complications which the diabetic patients experience. They are your Somogyi effect and dawn phenomenon. So that is what we will be learning today. So before we head towards today's class, just a quick recapitulation. I hope those who are present here, they have also attended the previous class which we have done. So just for a quick recapitulation, I have a MCQ question here. Just go through the question and just try to find the answer.
Which of the following is the best parameter to know about the control of DKA? Yes. So I will pick up. Ashruti, no. Sheikh Rafia, I can also translate the question in Bengali. Sheikh Rafia, do you want to try? Moitri Datta.
Urine ketone.
Urine ketone. Good. Sheikh Rafia, good. Yes. So most important to check, because one question came to me also during the seminar. One girl was asking the DKA symptoms are often confused with the sick days. So how can we distinguish that the person is having DKA? Person is having dry mouth, nausea, vomiting, so fruity smell, mouth. So how can we distinguish? So checking the urinary ketone, you can distinguish. So very nicely, this question is very important. Thank you.
Right. Thank you so much. Yes. So yes, you are absolutely right. Ketone, which are present in urines, they are the best parameter to identify whether the person is still in ketosis or the person is overcome. Now today we'll be learning about the two phenomena, like I told you, dawn phenomenon and Somogyi phenomenon. Now here we have a comparative study. Now what you can see is we are learning about the glucose levels in 3 different stages. So just see here, we have 3 conditions, that is bedtime, we have a condition of overnight and morning hours. So at the beginning of the class, like I told you, that here you will experience that in the morning hours, the blood glucose level will be high. So what you see in both the cases, blood glucose level is higher, right? That is what the graph is showing you. Can you tell me among these two, which is showing high blood glucose level in the morning hours?
Sigmoid effect.
Yes. Yes, Aisha, you want to say?
In Somogyi effect, it will be showing high blood glucose in morning.
Okay, so right, so you find that in the condition of Somogyi effect, there is a higher blood glucose level than that of the dawn phenomenon. And what is common among both of them? There is another thing common, that in both the conditions you see, the blood glucose was normal at the bedtime. So after the meal, after the dinner, when the person generally go for sleep, at that time, if you check the blood glucose level, you will find it normal. But then the major change that is taking place in both the phenomenons is on the overnight condition. So the major difference that happen here is due to overnight condition. Now, there is another important thing to note. Like at the very beginning, Shomdada has explained it very nicely, that this Somogyi effect is something which is happening due to our fault. So you can say this is a man-induced process, right? So we are responsible mostly for it. There are some other cases that we will see, but mostly we are responsible for this Somogyi effect. But the dawn phenomenon which happens, it is unregulated by us. It depends on the hormonal regulation. So that is another major comparative difference between two, right? So I hope we all have got the basic idea that why we are doing this topic today. The reason being that this topic tells us that why the blood glucose level becomes high or much higher in case of the diabetic patients. So we will be starting with this Somogyi effect or Somogyi phenomenon. So in this case, what we have learned, just check the previous graph, we have learned that there will be high blood glucose in the morning, and before which what you have experienced, there was very low blood glucose in the overnight. So mostly in this case, the blood glucose will fall, and then with a sudden rise, the blood glucose will rise. So what you find here is that in the early morning, around 3 to 4 a.m., there is a hypoglycemia condition. So we have seen this, that in the overnight condition, what was actually happening to the individual? The blood glucose was going down. So if you check the blood glucose level for these individuals, so you will find that around 3 to 4 a.m., there's a hypoglycemic condition, right? Now the question is that why this hypoglycemic condition appears? So what do you think, what are the reasons behind hypoglycemic condition for a diabetic patient, DM patient? What could be the possibilities? Arunima?
Right. Ma'am, it's the insulin, like whenever the insulin is being given, and that much insulin can again lead to that hypoglycemic condition.
Okay, correct. Which means that if we take excess amount of insulin, then of course there will be a sudden fall in glucose or hypoglycemia. And this is the main reason behind this Somogyi effect. So what you find here, that in the night hours, due to high insulin levels, sudden hypoglycemia will happen. And as a result of which, the body will start producing glucose. When you know that there is hypoglycemia, when your body has no glucose available, so your body will start producing glucose, correct? Can you tell me how the body will start producing glucose? What are the methods by which body will maintain glucose? It will increase glucose.
Ma'am, by gluconeogenesis.
Gluconeogenesis, very good. Arunima, any other process?
Glycogenolysis.
Glycogenolysis, okay.
Ma'am, glucagon will be risen up. Glucagon hormone.
Okay, glucagon, yeah, that is hormonal regulation, okay. Anyone else? Yes, Ali Reja, please tell me.
Yes, glycolysis also, ma'am.
Please repeat. Glycolysis. Okay, yes, right. If there is excess amount of insulin, then there will be increased glycolysis. Correct. Shalini?
Yes, ma'am. Insulin antagonist hormone, like glucagon,
Okay, very good. So in case if there is any antagonistic medications, any antagonistic drug administration or hormonal administration, then also there can be a sudden rise in insulin, right? So in all these ways, what happens, the insulin remains high and the person enters into hypoglycemia. And then in the next stage, you find that there will be hyperglycemia because your body will act upon it and your body will increase the glucose levels. So in the early morning, around 6 to 7 a.m., what you get to see is that the blood glucose level, which fall down in the overnight situation, now it is responding and is increasing. Now, the reason being the hormonal regulation which has already started in your body. Like the first major hormone we know, which is being secreted by the body whenever the glucose levels are low, that is glucagon. So there will be a glucagon surge. Next, there will be a stress hormone. So what we know, stress hormones, what do they do? Stress hormones are produced by the body when the body experiences there is some problem. So like we know, hypoglycemia is a condition when the body will feel that there is some problem, there is a phase of starvation, and the stress hormone, epinephrine, cortisol, growth hormones, they all are going to get produced. Fine. So as a result of which we see that this glucagon which is being secreted, it will now release the glucose from the liver. And that is how hepatic gluconeogenesis will begin. Now, when this gluconeogenesis process proceeds, then what happens? The blood glucose levels will rise. And other than this hormone, there are stress hormones also, right? So, do you know what are the common stress hormones that are related to glucose metabolisms? What is the general stress hormone that you know?
Cortisol.
Cortisol.
Cortisol, ma'am. Epinephrine, norepinephrine.
Okay, epinephrine, norepinephrine, fine. Now, if there is any homeostatic emergency of glucose, then which particular hormone will become active? Say, for example, glucose homeostasis.
Glucocorticoids.
Glucocorticoids, correct. So, in order to understand, we know that cortisols are always there, but particularly glucocorticoids are also going to become active. Now, here one thing to note, that is, in this condition, when your body is under this stress, then please remember that stress hormones, what do? They cause insulin resistance. We have learned previously that there are multiple ways by which insulin resistance can happen. There is lipotoxicity, right? There is hormonal influence. So this is the hormonal influence which is causing insulin resistance. Remember that whenever there is excess amount of cortisols in the body, then there will be insulin resistance. And whenever there is insulin resistance, then what will happen? The blood glucose will remain high. So just see in Somogyi effect, what we have seen, the blood glucose level was very high in comparison to that of your Dawn phenomenon, right? Because the body has gone through this phase of cortisol secretion. Right? So more the cortisol secretion, more active is your body in order to manage the glucose, and excess amount of glucose rise will take place. And other than that, what you find that these stress hormones, they will not allow the insulin to work, and as a result of which the glucose stays elevated for several hours. Correct? Do we understand this? Please tell me, last 2 points are important. Do we understand? Bolo. Last 2 point ki bocha geche?
Yes, ma'am.
Okay. So if you understand this, then please answer me another question. That is, many a times we say na, that, say for example, somebody is under any particular trauma or any particular stress. So we generally say that this may lead to diabetic condition or this may cause DM. So can you tell me what is the relation here?
Ma'am,
Insulin resistance.
Yes.
Please, yes.
Yes, ma'am. The stress hormones are released. So there is after the secretion, there is the insulin resistance. So in the similar way, the breakdown of the glucose cannot happen. That is why there is a surge in the glucose level.
Okay,
so it may lead to a diabetes-like condition.
Absolutely correct. Absolutely correct. Right. I will just repeat this question again. Some of you could not hear it maybe. So I asked that what is the reason that when a person is going through any trauma, any stress, any mental trauma maybe or stress, so we always see that this is being accompanied by blood glucose levels, high blood glucose levels particularly. So what is the reason here? The reason is that in this particular stage, the person is experiencing stress. So stress will release which hormone? Just now we have learned, Bornali. Stress will release. Bornali, can you answer? Yes. Which hormone will be released when you are in a stressful condition?
Ma'am, cortisol hormone.
Cortisol. Cortisol. And this cortisol will block which other hormone?
Ma'am, glucocortisol hormone. Sorry.
Oendrila is there. Oendrila Chaudhary, please
Yes,
answer.
ma'am. It will block insulin because it will cause insulin resistance.
Okay, correct. So whenever there is cortisol levels, whenever there is stress hormone, then it will block the activity of insulin, which means it will induce insulin resistance, right? So that is true for all type of diabetic patients. But in Somogyi effect, what we see that this stage will happen, but for a small duration. And as a result of which we see that after for a duration of several hours, the insulin level is lowered and ultimately the glucose level is higher. So we find that in Somogyi effect, the glucose stays high for several hours. Please tell me if this is clear to you or not.
Ma'am,
Yes, ma'am.
the cortisol block insulin is like for only less time.
Yes, it depends that in what form the cortisols are getting secreted, right? Say, for
Okay.
example, in this case, the cortisols is getting secreted for a limited particular time span. So after which, of course, the activity will be reversed. So we see
Okay.
that again the person is getting back to the normal state,
Okay.
right? Okay. So this is the basic mechanism of the Somogyi effect. Now here we have a graphical representation. See what do we have here? We have the blood glucose levels. So this is the blood glucose level that you can see. And on the other side, we also have the time span or the time period, right? So here we will be checking the blood glucose level in terms of the dinner time, the overnight time and the morning hours. So what you find that at the bedtime, the glucose is in range, right? This is the appropriate value, which is shown here. So of course it is around 100. So fine. So you find that the value is almost correct. But then suddenly there was a drop. And we have learned that for this particular drop, who is responsible? Excess amount of insulin was responsible. So we will find that if a person is going to the bed around 10 p.m. So mostly this shift of value, it happens around 3 a.m. 3 to 4 a.m. is the right time. Which means that if you want to check that whether a person is going into the Somogyi effect or not, mostly in hospitals, if there is any patient who is in this chronic stage of diabetes and who is taking insulin, then many a times this midnight testing of blood is done, just to identify that whether the person is going into the Somogyi effect or not, that whether the insulin which is being given, that is perfect for that individual or not. So what do? They check the value of glucose when around 2 a.m. So mostly in order to identify the Somogyi effect, the right time to check the glucose levels will be 2 a.m. before the person goes into this phase of excess hypoglycemic condition. Because once the person enters into the phase, then definitely the person is going to develop the other symptoms. So we don't want that. So around 2 a.m. it should be checked. Now what happened after 3 a.m.? The body will definitely start fighting against it. And in order to do that, it will start the process of gluconeogenesis. And it shows that how the excess gluconeogenesis and glycogenolysis are increasing the blood glucose level. So by the time it's morning around 6 a.m. to 7 a.m., the blood glucose level is very, very elevated. And you can identify that the person is having this abnormal situation of diabetic mellitus. Do we understand the time frame for the Somogyi effect?
Yes, ma'am.
Yes, ma'am.
Okay. Now, so in the Somogyi effect, what we have learned as a whole, we have learned that generally the glucose levels are going to be right. And the high insulin which we are suspecting that is being given to the individual, it is at around 9 p.m. Right? So around 9 p.m. we are experiencing that the high insulin dosage. Around 2 to 3 p.m. we see that the hypoglycemic conditions will develop, right? At 2 to 3 p.m. And this hypoglycemia is generating stress. And this stress is releasing your hormones like glucagon, cortisol, epinephrine, norepinephrine. And that is how ultimately your body end up in the stage of hyperglycemic condition in the morning, right? So this is the general pathway that happens for all the Somogyi effect. Now the question is that how it is different from the dawn phenomenon or the dawn effect. So we know that in dawn phenomenon also there will be a rise in blood glucose, correct? Now tell me one thing, what is the meaning of this word dawn? Dawn means? Ki bujhi dawn bolte?
Very early morning.
Early morning, right? So basically you will find that in these individuals, the blood glucose will rise at what phase? Around 4 a.m. to 7 a.m. So initially in the previous case, what we have seen, what was the time frame? It was around 6 a.m. to 7 a.m. Now the time frame is 4 a.m. to 7 a.m. Correct? So in both the cases, blood glucose will rise. And in the dawn phenomenon, it will be around
Once
4
more,
to
can you
7.
please repeat? Your voice was breaking in between. Just the same thing you can repeat.
Sure, I'll do that. Right. So here I was discussing that in the dawn phenomenon, around 4 to 7 p.m. we see that the glucose level is higher. But in the previous case, that is in Somogyi effect, we have seen that around 6 to 7 p.m. the glucose level was increasing. Right? So the time frame for the rise of glucose is different in both the situation. In both the situation, glucose will rise, but for dawn phenomenon, it is little earlier, and in Somogyi, it is little later, around 6 to 7, and for dawn, it is 4 to 7. So the time frames are different for the hyperglycemic condition in both the cases. Right? Am I clear?
Yes, ma'am.
Yes, ma'am.
Yes.
Okay. So
Ma'am, may I ask a very little question?
Yes, please.
Ma'am, what? So that means, ma'am, in Somogyi effect, the duration of the hypoglycemia is bit longer than the dawn effect, right, ma'am?
Yes. See, no, there is one thing to note. Hypoglycemia you're talking about, right? See, in dawn effect, you are not going to experience any preceding hypoglycemia. Okay. We will be learning this, right? Hypoglycemic condition is for the Somogyi condition. Right? Hyperglycemia is common in both. Hypoglycemia is predominant in case of Somogyi effect, not in dawn phenomenon. Do we understand this?
Ma'am.
Okay.
Yes, ma'am.
Right. So the first point of difference we have identified that the time frame for hyperglycemia is different. Now the second point is what we have learned in Somogyi effect. We have learned that there will be first hypoglycemia and then there will be hyperglycemia. Correct? But you will see that in dawn phenomenon, there is no preceding hypoglycemia. It is not that first there will be hypoglycemia and then there is hyperglycemia. No. If we just check the graph of dawn phenomenon, just see, in the bedtime, the glucose level was normal. In the overnight, also your glucose level was normal. But then suddenly there is a rise in the blood glucose. So there is no stage of hypoglycemia. Correct? This is another major points of difference. This point is clear to all?
Yes, ma'am. Yes, ma'am.
Okay.
Yes, ma'am.
Right. So other than that, what do we find here? That in dawn phenomenon, the cause for this phenomenon is little different. Because in the previous case, what we have learned, Somogyi, why it was happening? What was the reason? Why Somogyi generally happens?
Stress hormones.
Due to high
Stress
insulin,
level.
in the
Higher
night.
insulin level
due
at
to high
bedtime.
insulin. Absolutely, due to high insulin level. Correct. I told you at the very beginning that Somogyi effect is a man-made situation, right? So it is like we could not calculate the right amount of insulin. By our calculation mistakes, maybe we have given more amount of insulin. Maybe the person has mistakenly taken more amount of insulin, right? So that is a man-made situation that happens. In dawn phenomenon, it is not that. So in dawn phenomenon, what is happening? You will find that here there can be insulin resistance, of course. The same thing is happening here. But then this is due to the cortisols and GH hormone, which generally lies in early morning. So in the last case, what we have learned, cortisol levels were high in the Somogyi. But what was the reason for cortisol level? Hypoglycemia. First there was hypoglycemia, and due to that, your body has started producing cortisol and GH. Now in dawn phenomenon, what you find? You find that in the early morning, there is a cortisol level which is always higher. Achha, tell me one thing. Do we know about the melatonin hormone? Melatonin hormone, do we know?
Yes, ma'am. Serotonin theke
Achha. Pineal gland secretes melatonin hormone, right? When it is secreted?
At night.
At night.
At night time.
Yes, at night when we sleep, right? Mostly for the adolescents or for the teenagers or for the children is very predominant. So at night it is mostly secreted. And we also have to remember that the hormones like insulin, cortisol, glucagon, all these hormones, they are related to the circadian cycle. Right? Do we know about this biological clock system? Biological clock system?
Yes, ma'am.
Yes. So this biological clock system, it automatically changes the insulin levels. Like, can you tell me that before meal, which hormone will be high? Insulin or glucagon?
Glucagon.
Glucagon.
After meal, which hormone will be high?
Insulin.
Right. Now, as per this cycle, what you see that body has a tendency that the insulin level in an individual will rise at a particular point during this feeding time. So even if the person is not taking the food at that time, then also a insulin rise will happen because your body is habituated about it. Similarly, for cortisols also you will find that cortisols also follow this circadian cycle, and as a result of which the cortisol levels are also higher in the early morning hours. And the growth hormone. Growth hormone is released by all, like we know. For some it is more, for some it is less. But then growth hormone is very much similar to cortisol and epinephrine. If you check the previous slide when we were discussing about the hormonal regulation, can you see what hormones we have talked about? We have talked about stress hormones, right? Just follow the slide. We have talked about stress hormone. We have seen that stress hormone was related to epinephrine. It was related to cortisol. It was related to growth hormone. Remember one thing, growth hormone, epinephrine, they work together. So whenever there is a rise in growth hormone, automatically body will produce cortisols. So they are actually released and activated together in the body. This is one important point to note. Like say, for example, you are experiencing that there is a child who is an obese child, correct? So an obese child means that in this obese child, the height does not increase much, but then the child is gaining weight and the child is turning obese. So mostly for those individuals, for those patients, what you experience is that growth hormone secretions are less. Why? Because in their body, the cortisol and growth hormone both are deactivated, both are reduced due to high levels of insulin. Now, when that same child will do activity, that same child will do exercise, the child will go and play, then at that time, the body will start producing the cortisol. And with the cortisol activation, the growth hormone also becomes activated. And that is how that same child will start losing the weight and the normal body metabolism will begin. So from here, what you understand, what you relate that cortisols and growth hormone, they are interrelated hormones. Do we understand this fact? the relation of cortisol and growth hormone? বলো, এটা না বুঝতে পারলে বলো।
Ma'am, repeat
ম্যাম
please.
প্লিজ আরেকবার রিপিট করুন না।
আচ্ছা, what about others?
Only
Others, do you
Bonali is
understand?
saying, no other Reem.
ম্যাম একবার
Ma'am, understood.
Reem understood,
Understood,
na?
ma'am.
These are the application things. Remember one thing, whatever you have to apply na in your real life situation, you are not going to get it written anywhere in any book, I tell you. You have to understand and you have to relate by your own to apply that concept. So here I am showing you the path which you can use in your real life situations. Like, see one thing, I have given you example of an obese child, correct? So I hopefully I think that many of you have experienced that many a times parents come with this problem that the child is obese, right? The child's height is not increasing, and then the child is certainly gaining weight and turning obese day by day, right? Have you experienced such type of situation?
Yes, ma'am.
Today only I got this patient, same
Okay.
patient. Now height is not growing, and because height is not increasing, it's showing the weight is also, BMI is also high. So this is the major concern. And when I calculate the mid parental height weight for the parents and plot it in a growth chart, I find that the child should grow in this proportion but not growing. So this is the reason. And even doctor has asked for the fasting serum insulin test.
Absolutely.
So these are the things very important. Even the signs of acanthosis nigricans, truncal obesity is there in the child. Some symptoms I made the parents understand that these are some of the symptoms. You should look it out. You should not ignore for the child. So these are the very important thing. Whatever you are discussing, please concentrate in the class. Whatever just now ma'am is saying, that you will not find in any books. From your daily books, and today's class is very practical. Every class of ours, Cognized Nutrition, is practical class. So try to understand practically. Any confusion you can ask several times, but without asking, just go back and বুঝতে পারলাম না, I cannot understand. Don't do that. হ্যাঁ, তো এরকম কালকে অনেকে আমাকে বলছিলে একটু বুঝতে অসুবিধা হলো, তোমরা জিজ্ঞেস করো না, বাট তোমাদের কালকের ক্লাসের ভিত্তিতে we can arrange another class.
Yes, absolutely.
I don't have any problem to add extra class, but you have to extract more and more from this platform. Even I am just sorry, I am disturbing the class. Even one of our dietitian fraternity, I was talking to a hospital dietitian. She has not ever even attended our class. She is not aware of this thing, but I don't know how she came from her interns or from the other dietitians. That Cognized platform is very much enriching, and she came to know about you. She even don't know you, Vijaya, but she came to know about you. There is a madam from biochemistry, she's teaching. So that particular, I am not telling the name of that hospital, I will tell you offline, but she is appreciating so much about this platform, about the way we are teaching. So but the thing is, there is a lack behind the students that you are not utilizing. You should utilize, because you will not understand right now. When you full-term practicing, you will understand what you are missing. So please utilize this platform. Even that madam is saying that even at their time or at our time, we didn't get this kind of platform. So COVID is a blessing for us, because we got this online platform, and people from many parts sitting at their home can attend this class. If it is offline, so it is difficult for the people to attend all these types of classes. And even if it is difficult for us to get Vijaya ma'am also, so we cannot get her in this way. So thank you so much once again. Yes, please continue that class.
Yes, right. So I will just explain that particular example again, because that is a very common thing just now Shominta has explained, right? So we were discussing about an obese child. We have seen that in those children, the growth is not taking place, height is not increasing, but then the child is obese. Now tell me one thing, obesity occurs due to which particular hormone? Obesity is related to which hormone?
Should I give any clue? I think you can answer. It starts with
leptin.
Leptin. Any other simple hormone that you always talk about?
Insulin resistance.
Insulin. Yes, insulin resistance, right? So, okay, so obesity, insulin resistance, very much related. We have learned. Now, see one thing. We have also learned in today's class that cortisol, what it will do, it will create this situation of insulin resistance, right? So, which means that there is a strict relation between epinephrine, cortisol, and growth hormone. What cortisol is doing, growth hormone will do the same thing. The same thing will be done by epinephrine, right? So, this is a group of hormone which is performing the same type of pathways in the body, right? So when you are getting a patient who is having trouble with growth hormone, which means at that point, you have to see that whether the child is doing exercise or not. Because when you do exercise, then what happens? Of course, your body enters into a phase of starvation. Your body enters into a phase of cortisol levels higher and epinephrine level higher. And that is how that child will break that bondage of obesity. And these hormones will help to act the growth hormone properly in the body, and the height of the child will increase, and slowly the obesity will be controlled. Do you understand that the relation between these hormones, it will always happen together. They cannot occur alone. They will always happen together.
You understood this line? Vijaya, one
Yes,
more
yes,
time,
yes,
just tell in
ma'am.
Bengali this line, how this child's obesity is related to this and that and related to height. Just in one line.
Right. I will tell. Right. In Bengali, I am telling this that যখন দেখছো যে বাচ্চাটার ক্ষেত্রে ওবেসিটি আছে, তো ওবেসিটি আছে মানে আমরা কি বুঝতে পারছি যে সেই বাচ্চাটার ক্ষেত্রে গ্রোথ হচ্ছে না, তার মানে তার গ্রোথ হরমোন কাজ করছে না। কেন করছে না গ্রোথ হরমোন কাজ? কেন কি একটু আগে যেটা বললাম যে এপিনেফ্রিন, কর্টিসল, গ্রোথ হরমোন একসাথে কাজ করে, ঠিক আছে? এবার ভেবে নাও বাচ্চাটা হচ্ছে ওবেস, বাচ্চাটা হচ্ছে খুব সেডেন্টারি লাইফস্টাইল, কোনো খেলাধুলো করে না। যদি সে খেলাধুলো না করে, যদি কোনো ফিজিক্যাল অ্যাক্টিভিটি না করে, তার মানে তার কর্টিসল কাজ করতে পারছে না। কর্টিসল যখন কাজ করবে না, তার গ্রোথ হরমোনও কাজ করবে না, and ultimately the height will not increase. তাহলে বডিকে কি করতে হবে? বডিকে ট্রিগার করতে হবে এপিনেফ্রিন, কর্টিসলকে, যাতে তার গ্রোথ হরমোনটা কাজ করতে পারে। So that child has to go through the phase of activity, the child has to go through the phase of exercise induced starvation, যাতে এই হরমোনের সেটটাই, তিনটে হরমোনের সেট যাতে কাজ করতে পারে, and they can show the height increase or height development. Do we understand this?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
Yes, ma'am.
Okay, right. তাহলে দেখো, based on this particular line, what you find here in dawn phenomenon, that in morning hours there is cortisol, right, which is present, and there is growth hormone which is present. So both the hormones are raised here. So as a result of which you find that in normal situation, this particular individual will experience high blood glucose level. Now, tell me one thing, that if I talk about a teenager, so in a teenager, which hormone will you see? Which hormone is common in teenager?
Growth hormone.
Growth hormone.
Ma'am, growth
Yes.
hormone. Growth hormone.
So, yes. Now
Growth
just
hormone.
explain. So what happened? So in case of a teenager, definitely this process will be active. Dawn phenomenon will be active. But do we ever get to see that teenagers coming with a dawn phenomenon problem? দেখতে পাই কি আমরা teenagers coming with dawn phenomenon problem? দেখেছো কখনো?
No,
No,
ma'am.
ma'am.
Why? Because that particular person is a normal individual. That teenager is a normal teenager. So what will happen, even if the blood glucose is getting high, so at that point, the body, what it will do, the body will produce insulin, and the body will balance the glucose level. So your glucose levels will be balanced in a normal child. But just imagine if there is an adolescent child who is a DM1 patient. So what will happen? DM1 patient, adolescent child. তাহলে কি হবে? Adolescent child যেহেতু, which means that child will definitely have the cortisol and GH getting released. Now, in a DM1 patient, in a DM1 individual, do you experience any insulin rise or insulin surge? DM1
Oh, ma'am.
Insulin is absent.
Absolutely absent.
Okay, so the insulin is absent. correct? Which means that in type 1 adolescent child, Down phenomenon is very common during the adolescent phase, right? For type 1 patients, if they are in adolescent phase, Down phenomenon is very common because the growth hormone will be released, and then that same child cannot secrete the insulin to balance this hyperglycemic level. So for them, Down phenomenon is very prevalent. Do we understand?
Yes,
Yes,
ma'am.
Yes, ma'am.
Okay. Now, so basically this Somogyi effect, what is the main problem in Somogyi effect? Do you identify it? Is it hypoglycemia or is it hyperglycemia? Which is the problematic thing in Somogyi effect?
Ma'am,
Hypoglycemia.
both are happening. First
Hypo-
phase of hypoglycemia, then the hyperglycemia.
Okay, so the main culprit behind this exact phenomenon is hypoglycemia, right? So hypoglycemia is going to show us this type of effect. And we have learned just now that during this effect, there will be the cortisols and your other hormones which will act in order to increase the blood glucose levels. Now, mostly the Somogyi effect that we always talk about in the night duration. Now, I have shown you the charts, overnight charts I have shown you. Tell me one thing, in daytime, can it happen? Like say, for example, just after the or before the lunch, the patient has taken insulin injections, and by mistake, huge amount of insulin is being injected to that individual in the daytime. So can this effect happen in daytime also? Or can it always, or will it always happen in night durations? দিনের বেলাও কি হতে পারে নাকি রাত্রেই হবে Somogyi effect? কি মনে হয়?
নাইটেই হবে, কারণ হরমোন গুলো তো অ্যাক্টিভ নাইটেই হবে।
আচ্ছা, but then if there is high insulin, so there will be hypoglycemia. There will be hypoglycemia, na? And if there is hypoglycemia, then body will do gluconeogenesis. এটা ভাববার বিষয়. Please think and tell me, will it be possible that the body can will experience the same thing in daytime also?
সেটা লং অ্যাক্টিং ইনসুলিন আর শর্ট অ্যাক্টিং ইনসুলিনের টাইমের উপরে তো ডিপেন্ড করে হচ্ছে।
ওকে, ঠিক। কিন্তু যদি ধরো কারোর মধ্যে এরকম দিনের, say for example during the daytime, if the person is experiencing hypoglycemia, so will the person enter into this phase of Somogyi effect?
Ma'am, I think the food is there to make up, because we are taking food after a certain moment of time. But in night, we are, ma'am, facing a long gap, like between the last meal and having the first meal in the breakfast or that food.
Correct, absolutely right. So in daytime, mostly what happened, we are on a fit state, right? After maybe some time, we take something or the other. And that is how, what do? We balance this process. Now, can you, with this, there is another thing which is related. Mostly for the diabetic patient, what do we say? That after what time the individual must eat something? কতক্ষণ পর পর খেতে বলা হয়?
2 hours interval.
After 2 hours.
2 hours interval. Why it is a duration of 2 hours? What is the science behind it? Why the diabetic patient must eat after 2 hours? What will happen if they don't eat after 2 hours?
The insulin will be secreted up and the patient will go into hypoglycemic condition.
Please repeat, Arunima.
ম্যাম, আমি বলছি যে 2 hours এর মধ্যে, মানে যেহেতু আপনি বললেন যে ম্যাম, as you said, like the circadian mechanism is responsible. Insulin, cortisol, growth hormone, all are following the same pattern. Like after a certain period of time, if we are not taking anything, the insulin will automatically surge up, and whatever the glucose that is already present, obviously that will be on a lower. The insulin will, ma'am, make it down.
We're talking about diabetic patients. We're talking about diabetic patients. So, in a diabetic patient, you get to see this type of insulin surge happening by its own. In diabetic patients के लिए ही तो हम लोग बोलते हैं ना कि after 2 hours you must take something, you must eat something, right? So I am asking that what is the reason? What will happen if they don't eat after like 2 to 3 hours of gap?
Sugar will be fall.
Sugar fall. Okay, is that is the reason that we are worried about? That is the reason that we are worried about? একটু ভেবে বলো কি হয় জেনারেলি আমরা কি জানি না খেয়ে থাকলে কি বেড়ে যায়?
ম্যাম HCl সিক্রেশন স্টমাকটা 2 ঘন্টা পর পর খালি হয়ে যায়।
Okay.
ম্যাম
গ্লুকাগন
থাকলে তো ইনসুলিন লেভেলটা অ্যাক্টিভ থাকবে, তখন তো গ্লুকোজে যেগুলো থাকবে বডিতে ওগুলো ইউটিলাইজ হয়ে ব্রেকডাউন হয়ে যাবে, তখন তো হাইপোগ্লাইসেমিক কন্ডিশন হতে পারে। তো সেজন্য
Okay.
আমরা 2 ঘন্টা পর একটু একটু খাবার দেবো যাতে ওটা কন্ট্রোলে থাকে।
Okay. Acha, tell me one thing. After hypoglycemia, what will happen? Ki dekhe history, what we have learned till now. After hypoglycemia, what will happen?
Ma'am, glucose
Glucose formation by the process, bolo, by the process of gluconeogenesis.
gluconeogenesis,
Yes.
glycogenolysis.
The signs of this 2-3 hours frame is this, that if the person is not taking anything for this duration of 2 to 3 hours, then what will happen? If the person is on insulin, then at that point, what is believed? That the insulin will definitely work, so the glucose will be utilized by the body and the person can enter into a hypoglycemic state. Now, before the person enters into a hypoglycemic state, definitely body will try to counter react. So what the body will do? Body will start gluconeogenesis and glycogenolysis. So that is the reason why we always see that na khe thakle glucose bede jay. This concept that if you don't eat for a while, then your glucose will go high. So this thing is actually related to the Somogyi effect. So this is a normal thing that we all know. But in Somogyi effect, what happened? This thing becomes devastating. Why? Because you are in a sleeping state. You are sleeping. So in that condition, you do not realize that you are going into hypoglycemia. Your body will not realize that there is a glucose fall which is happening. So the person can get into worse conditions. But in the daytime, if you are awake, then of course you will be taking something or the other. You'll be eating something or the other after a while. And again, your body can experience that the body is feeling dizziness. The body is going into this stage of hypoglycemia. Right? So mostly this same thing can happen in daytime also. But in nighttime, it becomes very prevalent.
ম্যাম ওই আনকনসিয়াসনেসটা থাকে নাইট টাইমে,
Nighttime.
থাকে
Daytime. Daytime. Absolutely. That is the difference. I have a slide afterwards that I will be showing you that how it works. Correct? So now here what we see is that, so what is the basic difference? So what we have learned till now, that what we have to do is we have to check the blood glucose levels. And what was the time? 2 a.m. Remember? Because we have learned that after that only this glucose level will fall. So if after 2 a.m. you see that there is a glucose fall, then this is what effect? Somogyi effect. If there is no glucose fall, then that is what effect? Dawn effect. Right. Yes. So just now we have discussed about this hypoglycemia. So like I told you, in daytime also it can happen. During sleep also it can happen. So in the daytime you are active, right? You are conscious. So you have your own autonomic symptoms. You can understand that you are getting into this phase of hypoglycemia. There will be sweating, nervousness, tremor. You will feel hungry. So your body can adjust. But in the night time, what happens? You cannot experience any symptom because you are already in sleep. So your body will start sweating, right? While you are sleeping. You can see any nightmare or dreams, and in the morning time you will feel that you are very stressful, you have a headache, right? That is the experience that you can get. But in devastating condition, what happened? The person can even get into convulsions if there is a huge amount of hypoglycemia happening in night time, right? So basically this counter react mechanism, this regulatory mechanism, it must be done for a hypoglycemic stage. And how do we do it? We do it by taking carbohydrates, right? Whenever you see a person is going into hypoglycemia, the first thing is to balance the glucose level by giving carbohydrate. Now, if you don't do that, then what will happen? First of all, your brain will start showing symptoms, because which organ requires the huge amount of glucose always? Which organ asks for glucose?
It's the brain, ma'am.
Our brain.
So
Alone utilizes almost 20%, I guess, ma'am.
Yes,
what
right.
was the glucose requirement? Almost 20%.
20% has been uptaken. Correct. So your CNS will show the symptoms, right? And that can be confusion, abnormal behavior, that is fine. But then it can even lead into convulsions. So that is how this hypoglycemia can affect your body. Now, the question is that what are the causes of hypoglycemia in the patients taking insulin? So we have learned one reason is that wrong measurements of insulin. Correct. Or it may happen that missed or delayed inadequate meal. You have taken the insulin, but then the amount of food which you have taken is very, very less. So you don't have glucose available. So what the insulin will do? It will become hyperactive insulin, and that point it will stimulate this hypoglycemia. At least you have to take the meal properly, or else you cannot take insulin. So that is the reason why if a person is unable to take anything, right? So at that point, the person generally don't take insulins also, because if the person is taking insulin, then definitely the body glucose will be lowered. It does not matter that whether the person is eating or not eating. So that is another reason. Unexpected or unusual exercise. What happens when you do exercise? What goes down? Exercise करने से क्या कम हो जाता है body में?
Insulin goes down due to
Insulin resistance.
Okay. Which means that when you are doing exercise, your glucose get used up, right? Your body will already use the glucose. So you remember why it is not favorable. Last day also we have discussed for type 1 patients, why you don't generally suggest extensive exercise. What is the reason? Because the person is on insulin, correct? And then if the person is doing exercise, then what will happen? Depending on the exercise, the glucose utilization will happen. So if the glucose which is already available, it is getting utilized by
Hypoglycemia.
so the glucose is getting utilized due to exercise. So definitely in type 1 patients, you will get to see hypoglycemia. So exercise is another major factor. Third factor is alcohol. Can you tell me how alcohol is related with hypoglycemia? Anyone? How the action of alcohol is related with hypoglycemia?
This is very important part for counseling a patient. Diabetes counseling, you restrict alcohol. You say the patient that it can create hypoglycemia. Now the patient is an educated person. The patient may ask you as a dietitian that how alcohol can be detrimental for me. So you have to explain. Not maybe so scientifically, but you have to know the science behind it. Yes, very important question. I find alcohol.
Alcohol increases the insulin secretions?
Not really.
Don't think so complicated way. Think in a simple manner. You will get the answer.
অ্যালকোহলের ফলে হরমোন রেজিস্ট্যান্স হয়ে যায়, মানে হরমোন রিলিজ হওয়া বাধা পড়ে হরমোনগুলো।
Okay.
স্যার ইনসুলিন সিক্রেশনটা কি বেড়ে যায়?
Not directly.
স্যার অ্যালকোহল মানে তো শর্করা,
The glucose level.
fermented.
Yes.
Alcohol
is a source of glucose, simple carbohydrate.
ইনসুলিন সিক্রেশনটা কি বেড়ে যায় স্যার?
Hypoglycemia you will see for alcoholic individuals. Hypoglycemia.
Actually, you are good, right? Sangeeta, you are not wrong also. I can say you are not.
On one side, for alcoholic patient, what do you see? Hypoglycemia is occurring and fatty liver is occurring, which means whatever carbohydrate the person is taking, please turn off your mic. Whatever carbohydrate you are taking, that carbohydrate is turning into fat, but then it is not getting utilized by the body. Hypoglycemia is what? That your glucose levels are here troubling, right? Remember, glucose metabolism or carbohydrate metabolism is related to vitamins. Which vitamins, tell me? Which vitamins are regulated with carbohydrate metabolism?
Complex.
Thiamine. Complex to onek gulo. Which one? Thiamine. Okay, then
Thiamine, riboflavin.
Pyridoxine.
Pyridoxine. Then pantothenic acid. B5. ঠিক আছে? Remember, thiamine, riboflavin, pantothenic acid. These three are utilized during alcohol metabolism also. Whenever you take alcohol, alcohol will first use these minerals which are available, these vitamins which are available in your body. So as a result of which, what will happen? The vitamins, the coenzymes are not there. So how your body will regulate the glucose levels then? So that is the reason why in alcoholic patients, hypoglycemia chances are very high. Do we understand? Acha, see, there is a metabolic pathway for alcohol, correct? Alcohol is consumed, is utilized how in the body? It is uptaken by the liver, right? And then what else is happening there? Kisha convert her alcohol?
Ma'am, fatty
Fat.
acid.
Acetaldehyde. Alcohol is converted into acetaldehyde, which means there is a pathway. Now, in this pathway, what happened? Alcohol metabolism, it will utilize those B complex vitamins which are also related to glucose metabolism. So, as a result of which, what happened when your body is already having alcohol, then alcohol will use the vitamins which are there, that is B1, B2, and B5. They are mostly used during alcohol metabolism. So, as a result of which, the same person does not have enough vitamin available to utilize or to homeostasis the glucose level in the body. The glucose metabolism ta holo na. So as a result of which hypoglycemia is very prevalent in alcoholic individuals. Do we understand?
Yes, ma'am.
Yes,
Ma'am.
Now, other than this, what can be the reason? Errors in oral antibiotics or insulin dosage. Yes, so dosage can be changed. Poor designed insulin regime. Insulin regimen, who will say? Those who have done diabetic counselors or diabetic educator courses, they might be knowing. Insulin regime, you know there are different types of insulin, right? And they have their own time frames. So if the designing pattern, if the time frame and the type of insulin, the dosage of insulin which you have designed is not correct, then what will happen? Of course, there will be hypoglycemia. There is another condition which is called as lipoatrophy at injection site. Who can explain this? All diabetic.
Ma'am, it is ma'am, after with administration of insulin, the injection over a certain area for multiple times, it causes a fat accumulation under that skin, and which does not allow the insulin to be active.
Yes.
That is
okay. Okay. Any
So
Debomita?
Blackish in color.
But what is it actually?
Ma'am, what she said is right, and due to it, black patches occur in that area.
Right. Okay, Shubhana, anything else you want to add?
ম্যাম একই জায়গায় মানে ইনসুলিন তো ক্লকওয়াইজ নিতে হয়, তো এবার একই জায়গায় বারবার ধরে ইনসুলিন নেওয়ার ফলে যেটা হয় র্যাপিড লিপোট্রফি হয়, ইনসুলিনটা মানে ঠিকঠাক ভাবে কাজ করে না।
Lipoatrophy. Atrophy means change in structure. Change in structure of what? Lipo means fat, which means fat cell structure change. Like say for example, a person is taking insulin. So what you are mostly told, or you must have seen, they actually take a pinch, right, over the skin with some amount of fat, and in that they put the injection, right? That is how injections are mostly taken by diabetic patients. Now, if the same point of the injection site is same for long, then what happens? In that particular space, there will be atrophic conditions of the lipocytes, that is your fat cells. So there will be a structural deformity, for which when you are injecting the injection, so what happens? It does not reaches your epidermal junctional layer. The insulin you are injecting, but it is not reaching the exact site in your body so that it can enter in the bloodstream and it can start the process. Right? So many a times, this lipoatrophy is again a reason for hypoglycemia. There can be factious conditions where deliberate induced hypoglycemia is happening, which means purposely, say for example, purposely the person has not skipped the insulin. So that is a induced form of case. Breastfeeding mothers, yes, this is important. Breastfeeding by diabetic mothers. So for diabetic mothers, like you know, they are losing calories, they are losing glucose because the body has to produce lactose. So in order to produce lactose, body is taking all the glucose which is available. So for breastfeeding mothers also who are already diabetic, you see that there is high chance of hypoglycemia, right? So the sigmoid effect is common, of course. It is man-made, like we always say, but these are the conditions, these are at-risk conditions which can happen. Do we understand who are at risk of this sigmoid effect?
Ma'am, please repeat the factitious.
Yes, one by one, yes.
Ma'am, please repeat the factitious, deliberately induced, whatever you said. Please repeat, ma'am.
Okay, let's say for example, a person the person did not wanted to take insulin. The person has deliberately not taken insulin, right? Or maybe the person has deliberately tried to induce hypoglycemia, which is purposely done. Any condition which is purposely done.
Okay, ma'am. Thank you.
Right? Do we understand this? Any other doubt?
Last one.
Breastfeeding mothers. Okay, breastfeeding means what? That the woman has to produce lactose, right? The mother will definitely produce lactose. Now, lactose is produced how? How lactose is produced in the body? Glucose?
Prolactin and
Glucose plus galactose.
Glucose plus galactose. Yes.
Plus lactose.
hormonal
galactose, which means your body is already utilizing the glucose which are present. So the glucose which is already available, your body is utilizing the glucose, right, in order to produce lactose. So lactating mothers, they will definitely have higher chances of developing hypoglycemia. Clear?
Ma'am, that fat cells will damage at the like injecting parts, due to which it create like the fat cells create the fat cells damage, due to which the insulin will not reach to the target cells, right?
Yes, correct. Due to the atrophy, there will be a lump type of formation at that place, and ultimately, even if you are injecting, then the injecting amount of insulin will not reach to the epidermal layer for its absorption, and it cannot get into the blood circulation.
Okay, ma'am. Thank you.
Right. Do we understand?
Shalini. I'm একটা doubt clear করতে চাই। Then type 1 diabetes patient are more prone to develop Somogyi effect because they depend on insulin and they take insulin doses. But
yes, both can develop the condition. Both can develop the condition.
Then type 2 diabetes mellitus patient who take insulin, they are also vulnerable.
Yes, they are also vulnerable.
Those who take medication.
Those who are at medication, they are also vulnerable. Why so? You see that if you are taking medication, right? A diabetic patient who is taking medication means what? That the body is producing, I have told you in the first class only, that medication, what it will do? It will increase the insulin sensitivity, or it will promote the insulin activity. Correct? So which means that if the person is taking medicines also, then at that point also your insulin is hyperactive. So when you have a hyperactive insulin, there are chances of hypoglycemia.
Okay, ma'am.
Right?
Understood. Thank you, ma'am.
Okay.
Question মানে করতে চাই।
Moushumi, please turn off the mic. Yes.
প্রেগনেন্ট অবস্থায় ইনসুলিন নেওয়া যায়, মানে একদম কি সেটা মানে
most safest, Rinita, it is most safe to take insulin. No drugs have contraindication. Insulin is the only treatment during pregnancy and diabetes or gestational diabetes.
We have class on gestational diabetes.
Feeding period
আমার একটা প্রশ্ন আছে।
Yes.
তো ম্যাম ইনজেকশন তো দেয় বা স্যার মানে দুজনকেই বলতে যাই হোক, ইনজেকশন দেয় অনেক ক্ষেত্রে, মানে অনেক কিছু কমপ্লিকেশনস দেখা যেতে পারে। তো প্রেগন্যান্ট অবস্থায় কি এটা মানে একদম সেফগার্ড, সেটাই আর কি মানে একটা কোশ্চেন ছিল।
110% safe, but why you are saying that you need to clear? What is insulin? Is it any medication, Rinita Bhattacharya? Acha, you are student or practicing?
Practicing. এটা তো এটা ইনজেকশন, এটা তো
So what is insulin? Injection means it is not an antibiotic injection, or it is not like insulin. What? Our body produces insulin. From where it is produced? Beta cells of pancreas.
pancreas beta cell.
So the same thing we do not have in our body. We are taking loan. So you need to buy a car. You have short of money. You are taking loan from the bank. So there is no harm of taking loan. So you are taking a natural thing. So that is deficient in your body, that cannot control the blood glucose, because medicine can be harmful, because there are many contraindication giving different types of medicine. Though metformin nowadays it is they are giving, doctors, endocrinologists are giving metformin. But as you know, I am telling to Rinita Bhattacharya, so as you know that many medication like antibiotic or for antidiarrheal, fever, everything, even paracetamols are contraindicated. So আমরা বলি ডিউরিং প্রেগন্যান্সি মাকে যতটা সেফগার্ড করে রাখা যায় যাতে যত কম ওষুধ দেওয়া যায়। But insulin is the only safe mode of treatment. But if you follow the DIPSI guideline or ADA guideline, first intervention to control diabetes during pregnancy is diet. First you have to
কনসিভই তো হয় না, যে হাই সুগার থাকলে কনসিভ করতে প্রবলেম হয়, দেন আগে সুগার কন্ট্রোল করার পর
that is pre-pregnancy. That is pre-pregnancy. Rinita madam is asking about that post-pregnancy. During pregnancy. So as per yes, during pregnancy. So as per her concept, that yes, insulin is the most safe and can be given during pregnancy. Because
আমার একটা প্রশ্ন ছিল ম্যাম, বাংলাতে বলছি। ম্যাম আমরা ডায়েটে একজন ডায়াবেটিক পেশেন্টকে রুটি আর ভাতের মধ্যে আমরা ভাত সাজেস্ট করি না, বলি যে রুটি খেতে।
আচ্ছা, এই টপিকে আছে আমাদের নেক্সট।
না, আমার একটা কোশ্চেন আছে। তো ধরুন সমপরিমাণ রুটি আর ভাতে তো ইকুয়াল ক্যালোরি, তো কেন আমরা মানে ভাতটা কেন খেতে বলি না? কারণ
মানে আমরা বলি না, ডক্টরসরা বলে, ইউ ডোন্ট, মানে মেডিকেল পারসনরা বলে। From us it is same, but it is not same. Moshumi,
it is not same. Bhata ruti ni ekta gota class ache that we will discuss.
We have a different class, totally separate class.
Sugar থাকে না রুটি,
but that will be not in open forum. That will be only for the batch student.
Okay, sir. Yes. Now, yes, let's see the slide. So what we see, in case of
the reason their background is biochemistry. Everything you want to judge, you need help of Vijaya ma'am. Everything is biochemistry. So without that, only you, if you Moushumi Mishra, if you only keep the concept of rice and roti and
sir, eta ki sir
only calorie perspective we cannot judge.
Calorie is not related directly to diabetes. Glucose is related.
তাহলে তো ভাতে সরল শর্করা আমাদের খুব তাড়াতাড়ি ডাইজেশন হয়ে যায়, দেন গ্লুকোজে পরিণত হয়ে যায়।
What is there in rice? ভাতে কি থাকে?
Actually hydrolyzed starch and non-hydrolyzed starch এর একটা ব্যাপার থাকে।
Starch কত রকমের হয়? What are the bonds that are there in starch? What is slow releasing starch? What is resistant starch? That we have to understand before we judge rice or roti. তাই না? এটা কিন্তু আমি একটা সেন্টেন্সে বলে দিলে হবে না। So that is why we are saying, please do attend the class. You will definitely get to know. Correct? Okay. Now, yes, moving on with this. So just now what we have learned, that wherever there is a hypoglycemia, that is glucose level will fall. So what the body will do, right? Body will try to increase glucagon and body will try to suppress insulin. That is the body's law. And automatically when you're awake, so definitely your body will start the autonomic nervous system, and your autonomic nervous system will create the stress hormone. And what we know, whenever there is stress hormone production, so what will happen? What your body will do? Body will resist the action of insulin. So there will be insulin suppression, as a result of which quickly the body glucose will be recovered. Quickly the blood glucose level will rise. So that is how, in case of any hypoglycemic condition, body generally tries to increase the glucose by hepatic glucose formation and by glucose uptake. Right? So that is the normal pathway. Now, again, let's see this comparison. Just now we have learned one thing, right? That in dawn phenomenon, what you find, that the same thing will happen. In dawn phenomenon, the growth hormone will be secreted and there will be insulin clearance. Insulin clearance means in night what happened? The excess amount of hormone which we have in our body, that is mostly cleared. That is excreted or that is secreted out of the cells so that it can be cleared out of the body. So that is the insulin clearance which is happening for all. Now, generally in a dawn phenomenon just now which we have learned, in a non-diabetic patient, what will happen? The growth hormone will work and the child will grow. But in a type 1 patient, what will happen? You see, the body will not produce insulin. So as a result of which we see that for type 1 patient, the body cannot compensate the high glucose levels and the person will experience dawn phenomenon. This we have already discussed, right? वो हमने जो डिस्कस किया था कि एडोलेसेंट अगर कोई है टाइप 1 डायबिटीज तो क्या होगा उसमें, तो उसमें dawn phenomenon we will be able to see. Now in Somogyi phenomenon, what you find, there is a rebound at late night or early morning. So rebound, like we know, rebound means first it will fall and then it will rise. So it is basically a regulatory response that the body is doing. Yes. Now one thing to note that in dawn phenomenon, what do you find, that there is a it basically occurs due to endogenous insulin. So your body is producing insulin and that insulin secretion is decreased. Why it is decreased? Due to your cortisol, due to your GH, that particular phase, this insulin which is there, it is decreased. So as a result of which the body will show high blood glucose levels, and that is dawn phenomenon. In Somogyi effect, what we have learned, that here there will be excess amount of exogenous insulin. So we are taking insulin from outside. हमने insulin बाहर से लिया था. So that is the exogenous insulin effect. So Somogyi effect is also called as exogenous insulin effect. Dawn phenomenon is also called as your endogenous insulin effect. Right? I believe these two pathways, these comparative pathways should be clear to you. Bolo, comparison ta clear? Duto pathway motte? Okay. Right.
Yes,
so what we so initially what we have learned, that this is a man-made process. So it is basically due to poor management. But then dawn phenomenon is not about management. It is about the hormonal regulation, hormonal secretions. What else we have learned in Somogyi effect, that here there will be first hypoglycemia, then there will be hyperglycemia. And in dawn phenomenon, what we have learned, that here the insulin will act, and due to this action of insulin which is happening in the body, we find that the body will counter react and the body will develop hyperglycemic condition, because of course there is less amount of insulin which is available. So less insulin means dawn phenomenon the person will experience. Somogyi effect means more insulin injected from outside. So that is the major mechanism differences of the two processes. But do you remember what was common in between Somogyi and your dawn phenomenon? What was common?
Hyperglycemia.
Hyperglycemia. So you see, by the end, both are going to show you the same thing. So when you get such type of patients who are coming up with a morning hyperglycemic condition, you have to check the other factors. You have to check whether the person is alcoholic. You have to check whether that is a breastfeeding mother or not. You have to check that what are the other symptoms that the person is telling. And you must definitely be able to identify the two respective pathways which are happening. Okay, now in Somogyi effect, then what we have learned, there will be hypoglycemia, right? We have also talked about glucagon secretion. Now tell me one thing, whenever there is glucagon secretion, then what are the other pathways which will become activated in presence of glucagon? What will happen? You have told about gluconeogenesis, you have told about glycogenolysis. What about lipolysis? Yes, Ali Reja, please tell me.
Yes, ma'am.
Ma'am, there is an ordination cycle also.
Okay, what it will do?
It is doing the breakdown of. Okay, that's, I just forget it now. I think arginine hormone secretion.
Okay.
Urea produce করে, sorry. Urea produce করে.
Yes, that is for urea production, right? That is fine. That is in the urea cycle you're moving on, right? But in order to balance the calories, in order to balance the glucose, what the body will do? The body will also go for lipolysis. Do you remember? Insulin, what it will do? It will stop
lipogenesis. So when insulin is lesser, that means lipolysis will be continued.
Very good. So you remember that we have learned previously that insulin will stop lipolysis. So glucagon will promote lipolysis, isn't it? So as a result of which, tell me, whenever there is lipolysis, last also we have learned, what do you get as end product?
Free fatty acids
and end up with ketones.
Okay, so you get free fatty acids, and when free fatty acids also degrade, also break, then what do you get? You get
ketone bodies.
Right. So that is the reason that in Somogyi effect, ketosis is also a problem, right? Ketone bodies is also a problem that is mostly seen. So first of all, hyperglycemia is always there. But other than that, please remember that ketosis is again a concept that you will find with Somogyi effect. Now, in case of dawn phenomenon, what do you find? That, of course, in morning hours, you find it. And the major reason behind this phenomenon was the hormonal response. And what else we have discussed here? That, of course, the glucose levels will increase. Correct? So, in this case, we will find that this is already happening because the body is having less amount of insulin. And that is how there is high amount of glucose which is present in the body by the morning time. Fine. So in these group of patients, we generally check the values of insulin with a duration of 2 to 8 m. So you check, if you check the values, then what you will find that there is gradual amount of glucose and then suddenly there is a rise in glucose. And what we have learned till now, that in order to regulate this, of course, there is a hormonal regulation. Correct? So we have learned that hormones are mainly going to regulate this pathway. But tell me, can we do anything about the hormones? Can we do anything about the hormones here? Because we know that the body is doing it by its own. So we cannot do much about it, right? The other thing that can be a reason here is the insufficient insulin before the night. Of course, that is again a problem. If there is less insulin, then of course there will be more blood glucose. That is also fine. There is another solution that we have here. What is it? That is carbohydrate snack consumption at bedtime. Acha, tell me one thing. Do you know this concept of night snacking? Night snacking. What is it? But dawn phenomenon, I am sure that you must have learned or you must have seen any such type of patients. So what do you mostly suggest? Ki kora uchit? Dawn phenomenon jade thake tader jonne. What you can do? Just try at your...
Half
Ma'am,
cup
I
of
just tried it.
fruit or a glass of milk.
Okay. Okay, anything else? What you can do at your end?
Providing post-dinner meal, exactly like the thing is.
Yes, correct. Anything, if anyone if have some experience regarding this type of condition? Yes,
We can give high carbohydrate nighttime dinner and then go for some like carbohydrate rich food, a small snack like before bedtime, so that it doesn't go to hypoglycemia.
No, dawn phenomenon was not hypoglycemia.
No, sorry. Means,
So that is Somogyi. That is fine. Okay. Achha, but dawn phenomenon, what you can do? Those who are practicing.
We can control the insulin level. So
in
that
terms
the
of diet, what you can do?
High protein.
Nuts and milk is good.
Nuts and milks are good. Okay. Which means that, remember one thing, what we have learned, that why this glucose was rising in both the cases. Reason क्या था glucose rise होने का? Rise कैसे हो रहा था glucose?
Hormonal action की वजह से, stress hormonal action.
Okay, what are the pathways? Okay, but what are the pathways which were creating this high glucose level?
Ma'am, gluconeogenesis.
Gluconeogenesis. Okay, main trouble, gluconeogenesis. What we have learned, gluconeogenesis, how can you stop it? How can you stop gluconeogenesis?
Providing carbs.
By adding glucose.
Not exactly carbs, providing food, you can say. Right?
Food.
Right.
Providing
food, not exactly carbs. I have discussed this, right? Why it is say that after 2 to 3 hours, the person should take something.
Exactly.
Right. So that is the thing. Because see, if you are empty stomach, then you will start this hunger signaling. But then if you have something, if you eat something, right, it does not have to be a high calorific or something like that. But any form of food, probably like you said, nuts, milk, of course, that is a healthy form of fat. So that will work. And fat has its own satiety value. So that will definitely help. So what you can do is that for these dawn phenomenon patients, they must have a nighttime snacking. So that Aishwarya has already explained very well, that after dinner, it is being said that they must take another small meal or snack. So what it will do, it will lower down the chances of gluconeogenesis. So as a result of which, these persons, they will ultimately have less glucose available in the morning hours. So this midnight snacking or nighttime snacking, these concepts are very much prevalent, or they are relevant in terms of dealing with dawn phenomenon. Do we understand how to get into the management for these patients? Bolo, last point is important ekhane.
Yes, ma'am.
Subarna, clear?
Yes, ma'am.
Okay. Now you see here I have a graph, right? I have told you that the snacking thing is important, correct? Now here I have a graph to show you that how the snack is going to help you. See, this graph is about liver glycogen throughout the day, correct? So now tell me one thing, whenever you have low glucose levels, then your body will produce glucose, right? Your body will produce glucose how? By generating glucose. So tell me, what is the first pathway that your body will do when there is less glucose available?
Glycolysis to
Glycogen depleted.
Okay, glycogen
First.
depletion.
Proteolysis or lipogenesis.
ওরে বাবা, এতগুলো একটা একটা করে বলো. What is the first thing that will happen? Whenever there is less glucose, what your body will do? Not proteolysis. Proteolysis for it.
The body will break down the glycogen first.
Okay, first. So body will break the glycogen first. Next, what it will do?
Ma'am, for other source of glucose like glucogenolysis will happen.
Glucogenolysis.
I mean,
gluconeogenesis. Good. Please remember these two things.
One at a time, please tell. Otherwise, I cannot listen what they are saying.
Right. No, they are saying correct. So I'm really happy that, which means that they have followed the previous classes. So which means that at first your body will break the glycogen and then it will go for gluconeogenesis. Now tell me one thing. You need glucose, right? You have two pathways, glycogen breakdown, gluconeogenesis. Tell me which one is a more healthier option for your body?
Glycogenolysis.
Right. Glycogenolysis. Because we know that body has a normal mechanism where the glycogen breaks and the glycogen is replenished. So that is a healthy body mechanism. Whereas if you talk about gluconeogenesis, so gluconeogenesis is a process where other sources are being forcefully turned into glucose. So that is, of course, a secondary mechanism. So just experience, a person is entering into dawn phenomenon. Okay? So what you can do is, you can reduce the process of gluconeogenesis at your end. You can try to reduce the pathways of gluconeogenesis and you can promote glycogen breakdown. So in order to do that, what do you need? You need liver glycogen. So if you want that glycogen should break in dawn phenomenon and it should not go into gluconeogenesis, which means that definitely your liver must have that amount of glycogen which should be supplemented. So just see this thing. Here we have a glycogen curve. So here you see that how the liver glycogen level changes throughout the entire day. So just see, in the morning hours, your glycogen levels, say for example, after breakfast, you have good glycogen level. Then your glycogen levels are going down. Then after lunch, it will rise. Then it will again fall, right? But then when you take dinner, then what happens? Your glycogen level will again rise. But this time, your glycogen level will not fall. Why it will not fall? Because what you are doing here, you are taking a snack. So when you take a snack, then what are you doing? You are preserving this glycogen. And as a result of which, what happens? If this glycogen is preserved, then this same glycogen can break during that dawn phenomenon. So that is how when you take the snack after the dinner, then this snack will hold up the glycogen in the liver and it will make sure that when the dawn phenomenon is happening, this glycogen is broken and the amount of gluconeogenesis is reduced. So that is how this midnight snacking or the snacking habits can help the dawn phenomenon patients. Do we understand this thing? It's very important.
Yes.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am. Okay. Please, if somebody finds this difficult, please tell me. তাও যদি মনে হয় থাকে বেশি ডিফিকাল্ট বা কঠিন বলো. Okay. See, this is a graph. Don't get scared of it. Simple thing. क्या देखना है इस ग्राफ में? हमें एक ही चीज देखना है. What is it? That is gluconeogenesis. What did I told you? In Dawn phenomenon, what is the main trouble? The main trouble is gluconeogenesis. And Dawn phenomenon happens at what time?
In
between
early morning.
4 to 7.
Yeah. So in mostly in 4 to 7, which means overnight or early morning hours. Correct. So what you see here, you will find, let's see the glycogen values, the maroon color line. So after dinner, you see the glycogen values are rising. And in the morning, what do you find? Before the breakfast, the glycogen is highest. Sorry, not the glycogen, sorry. The gluconeogenesis is highest. So what is the peak point of gluconeogenesis? In the early morning hours. Correct? So which shows, this graph shows you that the dawn phenomenon, the high glucose levels that you get is not due to dietary sources. The fasting glucose which you mostly get, it is purposely with the help of glycogen breakdown, that is glycogenolysis, and also by gluconeogenesis. So by following this chart for your snacking habits, what you can do is you can reduce this gluconeogenesis. So when your gluconeogenesis is reduced, then your body will follow the glycogen breakdown or glycogenolysis. Do we understand how to deal with dawn patients, dawn phenomenon patients?
Yes, ma'am.
Yes, ma'am.
Okay. So yes, that was all. And of course, not to forget, so when you are into the phase of diabetes, then exercise is must. Now tell me one thing, that exercise will be beneficial for dawn phenomenon or for Somogyi effect? It will be beneficial for whom? For Somogyi effect or dawn phenomenon?
Dawn phenomenon.
Very good. Not for Somogyi effect, because in Somogyi effect, the problem was
Hypoglycemia.
So exercise will not help hypoglycemia. Exercise will always help purely hyperglycemia. So pure hyperglycemia is dawn phenomenon. So of course, if the person goes for exercise, so at your end, you can suggest evening snacks, that is midnight snacking. You can also suggest exercise. So that will help to increase sensitivity for insulin. It will also control the blood glucose level. It will make the cardiovascular system better. And definitely, you will find that initial hypoglycemia will happen, because like you know that after exercise hypoglycemia will happen, but then slowly the snacking and the insulin levels, it will balance the amount of glucose in the body. But then you have to remember that if there are ketones present in the body, if the body is already in ketosis, then the person should or should not go for exercise. If the body is in ketosis,
They
should not go for.
I should not go, ma'am.
Right. So that is the counseling that you can do at your end. Correct? So that is all.
Ma'am, if somebody has dawn phenomenon, so should we stop exercise for them?
No. See, exercise dawn, we are having problem with ketones, right? We are having problem with ketones. Ketones, যাদের আছে তাদেরকে আমরা exercise করতে বারণ করছি. So ketone is basically a problem of whom? DKA patients. Ketone is a basic problem of whom? DM1 patients, right? So if the person is showing ketoacidosis, of the person is showing ketonuria, then for them you have to limit the exercise, right? Or else exercise is very good for dawn phenomenon patients, because it will increase insulin sensitivity. So that is how they can easily overcome dawn phenomenon. Right? So, Shoma, clear?
Yes, ma'am. So we can suggest the dawn and Somogyi effect both for both exercise.
No, Somogyi, not for Somogyi effect. Somogyi effect, the problem was hypoglycemia, not hyperglycemia. Yes.
Okay.
Remember, and here the problem was hyperglycemia.
Okay, those who have Somogyi effect, we should stop exercise for them.
Yes. Okay. Any other question?
Thank you.
Any other question? This is all like we have from this particular topic. So I'm done with this section. So if
Ma'am, can you once like repeat with that the growth hormone and insulin that you said in dawn phenomenon?
Okay. Basically,
first should we stop now? We can stop sharing the screen now.
Okay, right.
We will take question for 10 minutes, then we will stop the class. Yes, Aishwarya's question we will first take.
Yes, Aishwarya, yes, right. Your question was regarding the insulin and what else you have asked?
Growth hormone in dawn phenomena. You told about like in child growth hormone regarding that.
Right, right. Basically, what happened if in the body there is an insulin surge? Basically, when a person is in obesity, so or in bad food habit condition, then the body will always have this insulin surge happening. Now, in that case, the high amount of insulin will block the mechanism or the activation of cortisols. Now, like I told you, cortisol, epinephrine, and growth hormone, they work together. So once your cortisol levels are lowered, then of course what will happen, the activity of growth hormone will also get lowered. So that is the reason why the obese child, they do not show growth in their height. So what we can do is we can promote the activity of cortisol and epinephrine. How to do that? By activity, by exercise, right? By exercise induced starvation, you can promote the hormonal activity of cortisols and epinephrine. When they are promoted, automatically the growth hormone will become active. You understand?
Yes, ma'am. Clear now. Thank you.
Obesity increases the insulin hormone.
Obesity, see, obesity means what? The person is in well-fed condition. খাচ্ছে তাই জন্যই তো obese হচ্ছে না? So well-fed condition means what? Well-fed condition means high amount of insulin in the body.
Okay.
Right.
Thank you, ma'am.
Yes. Any other question?
I have a question. In a diabetes patient, when we will go for to diagnose or check for the if he have a Down phenomenon or মানে প্রবলেমটা আছে কিনা আমরা ফার্স্টেই ডায়াগনোস করব কিভাবে যে এনার এটা দেখতে হবে মানে চেক করতে হবে?
Acha, first of all, the person will experience that headache, that nausea, and then the person will have high fasting blood glucose levels. So that is the first thing. That, say for example, the person is having normal blood glucose level at night, right? But in morning, the person is having very high blood glucose level. So that is the first thing that you see in a Down phenomenon patient. Right?
Ma'am,
we have to check.
1 minute. Megma finish, then Krititapa, please ask your question. Megma, tell me.
Means it have to check at night and next day morning also. Maintain, yes. Have to maintain.
Yes, right. You have to check the values. We have seen now. One is preferably 2 a.m. If you cannot do it at 2 a.m., then at least at bedtime, right? So the values will be required in order to be confirmed about this condition.
Yes.
Yes.
Yes, ma'am. I had a question. If a person with Down, who is showing Down phenomena, if we tell them to exercise, is midtime snacking required? Like the bedtime snacking, is it required at that stage? Like
what Down phenomenon you are talking about?
Yes, yes, yes.
Acha, okay.
The person has advised exercise.
If the person is, please complete the question. Yes.
Yes, the person is has been advised exercise and he is doing it. So, is the bedtime snack required for that person, or do we continue with it?
Okay. See, why are we going for this bedtime snacking? The only thing is to lower down the glucose levels at morning, right? So, if the person is doing exercise, if the body is responding well, if you see that while doing exercise, the glucose is already controlled in the morning hours, then there is no point of adding the midtime snacking.
Oh.
Right, but there is no harm if you add midtime snacking, right? That just midnight snack, it is not going to cause any harm, right? Because you are not going to give high calories or high glucose, so it can be added if the person wants to have it.
Oh,
okay. Okay. Next, I guess any other question? That is Shauradi.
Yes, ma'am. আমি জাস্ট একটা জিনিস জানতে চাইলাম যে নাইট স্ন্যাকিংটা শুধু ডন ফিনোমেননে দিতে হচ্ছে, ওটা কি সমগিতে দিতে হচ্ছে না? মানে এটা একটু বুঝতে পারলাম না।
Somogyi, see, what is the problem in Somogyi? See, Somogyi means the man-made condition. Like we have learned all the conditions, na? Now, say for example, you find that a hypoglycemia Somogyi effect is happening in case of a lactating mother or an alcoholic individual. তাহলে এই ক্ষেত্রে যেখানে জেনে বুঝে তোমার ইনসুলিনটা বাড়িয়ে দেওয়া হয়নি বা ভুল করে ইনসুলিনটা বাড়িয়ে দেওয়া হয়নি, where the body is not responding, for those conditions what you can do is you can increase the carbohydrate at night. That can be done for Somogyi conditions other than insulin mismanagement. For that cases you can give a good amount of carbohydrate at night.
Okay, ma'am. Thank you. Yes, ma'am.
Natasha Goenka.
Yes.
Yes, ma'am, like you have said that restrict exercise if the person is having ketosis.
Right.
So can you explain why we need to restrict exercise?
Okay, of course. See, exercise, like we know, exercise means utilization of what is stored in your body. So when we talk about that, then of course that is glycogen, which is going to give you glucose. But other than glycogen, what else breaks in your body? Can you tell me? When you do exercise, of course, glycogen depletion will happen. Other than glycogen, what else is breaking in your body?
Fat.
Fat.
Fat breaking down.
Yes. So when fat is breaking down, right. So when fat is breaking down, it will produce fatty acids. And these fatty acids will ultimately, they will ultimately break into acetyl-CoA and they will release energy so that you can continue the exercise. So in order to do that, you end up with what? You end up with acetyl-CoAs. And these acetyl-CoA units will lead to formation of ketone bodies. So it will ultimately increase the ketosis. Because your body is already in ketosis stage, then you are again adding ketones to the body. So of course that is not favorable. So we don't want it to happen.
Okay, so we don't allow like freehand exercises or walking,
Okay,
any
yes.
kind of this?
Yes. Now here that is a very good question. Remember, exercises of multiple times. I would request that everybody should know this, that exercise is of multiple types. Like mostly ketone bodies are formed due to fat. Correct? Remember, fat breakdown will happen whenever there is a prolonged exercise. Fat breakdown never happens whenever there is a instant, or you can say a intense exercise is happening, like cardio. Fat break.
High intensity workouts.
High intensity workouts does not break fat. They break glycogen. Prolonged exercises break fat. So it's very important that what type of exercise that person is doing. Because we want to break the glycogen, but then we don't want to break the fat. So it should be synchronized in that way. Natasha, do you understand this part?
Yes, ma'am.
Okay.
Ma'am, if the patient is obese, then we need to lower down his weight also, na? So how to advise the exercise?
Obese and with what other condition? Obese and Somogyi, or obese or type 1? Obese and what? DM, normal DM.
Obese and normal DM.
Okay, yes, no problem. See, normal DM means we consider it to be type 2. Now, for those individuals, what you can do is you can definitely give exercise. You can give both type of exercise. High intensities, that is aerobic high intensity. You can also give anaerobic prolonged exercises. So like that, what you do is you lower down glucose and you also lower down fat. Now, remember one thing we have learned earlier now, fat is very much related to insulin resistance. So when your body's fat is going down, then of course insulin sensitivity will happen and insulin resistance will go. Correct? So that is another thing that can be done. So for type 2 is very important. Exercise is must.
Ma'am, if there is Somogyi and or dawn effect, and also there is obesity present, then what should do?
Okay, like I told you that Somogyi is not directly related to exercise, right? So for Somogyi, the person can do exercise, that is fine, but it's not going to help the situation of maintaining Somogyi effect. But then for dawn phenomenon, it is definitely required. And for obesity, it is always required. So you can tell the person to go for exercise, but then Somogyi effect will particularly not get affected due to exercise. Obesity and dawn phenomena are going to get cured, you can say.
Okay, ma'am. Thank you.
Okay. Okay. Any other question left? I guess I've already answered, Natasha.
Already answered many of the questions. So we can conclude the class. What is our next plan? GDM too we have planned. GDM 2 days, you and me. Except
Right.
for GDM, any in-between plan for any class on diabetes?
Yeah, actually there are multiple things that we can discuss about diabetes. Maybe
especially those who are related to their clinical practices. So like these two classes, DK, Dawn, these are all management. These are related to the diabetes management. So we know there are many things maybe we will not be able to cover. Somebody are taking the tuitions under you, like Swati, Mafuza. They were telling that lot of things they are learning from you everyday basis.
Yes, in this
Swati
batch we have
very
Aisha also.
good
Aisha has also joined. Aisha in this batch? Yes, Aisha.
Risha.
Aisha.
Yes,
ma'am.
Aisha.
Yes, ma'am. I actually enjoy all these classes, and whenever it comes, I just join. I just jump and join.
Thank you so
This
much.
is the passion. This is called passion. Okay.
It was wonderful. Thank you so much.
Thank you, ma'am. Thank you, sir.
Thank you, ma'am.
Thank you, ma'am.
There are many new student. Vijaya, can you just type your mobile number in the chat box so that they can contact you if they need any help? So madam's number will be in WhatsApp. Don't call her directly. Just put on WhatsApp that you have attended this class. Few students are there who are also not from our batch 4. So that's why few new students, they are planning to join the course. So this is a like demo class for them. So that's why I asked your number in the group.
Right. I have already given in the comment section. Please check. It's 9681370273.
Everybody is also not. Yes, everybody is not with me in WhatsApp. So take madam's number. Madam's name is Vijaya Das. So you can
definitely connect if you need any.
Not only the nutrition, if you directly need any biochemistry coaching or biochemistry classes or special classes, so madam can give you. But
those who are already doing MSCs or those who are preparing for anything else which requires nutritional biochemistry,
like RD, or maybe you are preparing for NET exam,
you can definitely contact.
It is really blessings for all of us to get Vijaya. Thank you.
Thank you so
Ma'am,
much.
we don't have your phone number, so I didn't wish you Teachers Day. So today I'm wishing you belated happy Teachers Day, ma'am.
Thank you so much. Thank you.
Okay. Thank you.
Okay.
For me, ma'am, belated happy Teachers Day.
So much.
Teachers Day is for every day is Teachers Day. Every day is Children's Day. We are connected every day.
Every day, absolutely.
Every day we are connected. So thank you for your wishes. We got several wishes from you. So we want you enrich in this platform. Jitna ho sake you uplift your knowledge. So that is the only thing of this platform. Whatever that senior dietitian was telling me today over the phone, she was also telling the same thing, that the knowledge is very important. That knowledge, bookish knowledge, not the bookish knowledge, the practical knowledge.
Absolutely.
Class link. What class link? Class is, you are already in the class, Nagma. Okay. It is in the separate message.
Right. Thank you so much.
Thank you, ma'am. Thank you, ma'am.
Thank you very much, ma'am.
Thank you, ma'am.
Thank you, ma'am.